Current unmet needs are, in particular, some of the subsets of atrial fibrillation patients, namely those with persistent or long-standing persistent atrial fibrillation. They are the least studied, so any studies that look at that particular group of patients is very much welcome, particularly if you look at the guideline unmet needs aspect. So the CASA-AF study was initially a pilot study which we published in Heart Rhythm Journal in 2017. In essence, it's looking at another unmet need, which is the comparison of catheter versus surgical techniques to ablate atrial fibrillation. This area has been studied briefly thus far, but there is a lot more that needs to be delineated, and we are doing now a follow-on, which is a randomized control trial at the Royal Brompton Harefield Hospital. At HRS this year, there is an Emerging Technologies Summit. So that should tell you that there is a lot going on, both from mapping atrial fibrillation to ablation tools. Everything from using cold temperature, heat, radiofrequency, to very much novel techniques. So there's going to be quite a lot of new technologies, and I think it's our job as physicians to try and wade through the ones that may be of most benefit to patients. So my personal hope is this emergence of digital health. For me, it's a personal interest, and it's great to see patients being empowered to look at their own cardiac rhythms, such as I'm sure you'll have heard from the Apple Watch release earlier this year. So there's a summit this year on this particular topic, and I think it's going to be the start of a lot of digital health work in electrophysiology.